So I'm with Eric.nuss, a very exciting friend who's with the, what is it, Henry Schein Business Solutions?
Dental Business Solutions, correct.
And you work basically with all my friends. Tell them all the friends you work with.
So on the consulting side, it'd be Henry Schein, Charles Blair, Matt Krieger from $1 Million PPO, Wendy Briggs from Team Training Institute. We have a house brand of consulting services called 360 Practice Development. And then all the service providers that are in essence providing business service outsourcing to our customer base. So this includes everything from marketing to HR, IT support, compliance training, operations support. So oftentimes we'll talk to a doctor and they'll say, after meeting with a consultant, these all sound like really great ideas. Who's going to get this done? And the consultant will say, well, you are, doctor. And the doctor says, oh no, I'm not sure that's something I want to do myself. Could you do it? Well, the consultant most often doesn't have the bandwidth or the support to be able to really execute. So we have operational temporary support where they act as, in essence, a temporary CFO or COO for a period of time. So literally everything from payroll services to operational execution we can provide service through, and that's really my responsibilities is consulting and business services.
Now, do those consultants all work together, or are those separate programs?
They're all separate. They all have their own independent brand.
Yeah, so go over those 4 brands.
Okay, so Henry Schein is really a generalist in practice management consulting. His forte is his background is in accounting. He's got a huge team that they'll do everything in practice management, but primarily where we see the best application for Henry Schein is front office efficiency, collection systems, accounts receivable, accounts payable, how are we getting the money. On the exact opposite end of the spectrum is Matt Krieger with $1 Million PPO, who will talk more specifically about optimization and efficiency on the clinical side. So how are
that's Matt Lowe?
Matt Krieger.
Matt Krieger?
Matt Krieger with
How do you spell that?
Krieger.
And then Mac, M-A-C?
M-A-T-T.
Oh, Matt Krieger?
Krieger.
Spell it again. K-R?
Krieger.
Okay, and what's his forte?
His business is called $1 Million PPO. And, branding-wise, I think maybe a slight misconception. You don't have to be in a PPO in order to work with Matt. What you do need is support in clinical optimization. So when we talk about lean systems and lean management from a business school perspective, we talk a lot about waste containment. This is not so much waste containment as much as it is patient flow. How do we get the patient to flow through the business cleanly, succinctly, and efficiently? If we're turning over rooms, every time we turn over a room, it's a cost of $30 to $50 in time and material costs. So if I can eliminate moving a patient from op to op or from op to home and back, I would much rather get some efficiencies doing same-day dentistry. The misconception is that same-day dentistry is just CAD-CAM. Same-day dentistry is sealants and fluoride and pit and fissure support and minor cosmetic procedures. It's things that we can do in the operatory within the same appointment time without sending the patient on an escapade to find a new appointment and possibly look for competitive service someplace else.
I think I'm confusing that PPO with another PPO. There's a couple of consulting companies that have PPO in their name.
That have PPO in their name, sure. So Matt Krieger's business really is full service consulting, but it's all about optimizing efficiency on the clinical side of the business. They'll do everything that every other practice management consultant would do. If we need to address team harmony and behavior styles and collections and process and so on and so forth, they will absolutely do that. But as far as a differentiation point, what I like to say is not unlike going to the emergency room. If I'm going to go to the emergency room and I have a cut on my leg, I don't need them to check my eyes. I need them to look at my leg, triage the pain, the problem, the source of the issue for why I'm at the emergency room. So when we talk about the 4 brands of consulting, I most often am going to triage front office with Henry Schein. I'll triage back office with Matt Krieger, $1 Million PPO. I'll triage hygiene with Wendy Briggs and Team Training Institute.
She's out of Utah?
She's out of Utah.
Where in Utah? Provo or
Salt Lake.
Salt Lake?
Yep. And then if I want to triage $1 Million PPO, Strain, Team Training Institute, Jameson, if I want to triage patient communication and case acceptance. Jameson, bar none, has that.
Kathy Jameson's
business. She's since sold it to Jess Weber. That business has been sold to the Weber family. That's
I didn't know that.
Yeah, Carrie and Jess Weber. Carrie is actually Kathy and John's daughter. And so,
really?
Yep. So that happened the transitions happened over the course of the last about 5 years. But yeah, Kathy is really, to some degree, focused more on speaking and less on practice management, ongoing consulting.
And her husband John just successfully beat prostate.
That's right.
Good for John.
Yeah.
He's my buddy.
Yeah, I love John.
He's a tough
Creighton grad.
Yeah, I went to Creighton, and
you did.
Yeah, and I grew up.
In Omaha,
in Wichita, Kansas. I went to Creighton, and he's from Oklahoma.
Yep.
And he's a tough cookie, man.
Yeah.
He got smeared by a pickup truck one time. Beat that. Prostate. He's just a tough old farmer.
Yeah.
So I think it'd be so. What's Wendy Briggs doing in the hygiene? I mean, what is?
So her business is called Team Training Institute. She's really, really hyper-focused on how do we create better efficiencies and optimization just from within the hygiene department. So when you look at a practice and we can see that patients are haphazardly coming back in the hygiene department, but they're not coming back for periotherapy, and we're not seeing any referral business per se into cosmetics or the doctor side of the business. Wendy's hyper-focused on how do we take care of what we can take care of by the hygienist, and then also using the technology and equipment available to that hygienist to then pass forward a lead to the dental clinician, the dentist, for more major service. 80% plus of restorative work should come from the hygiene department. People don't just call up and say,
80%?
For sure. People don't
Really?
why not? I mean, they're there. Why would we not recognize that when we're taking good intraoral cameras, when we're seeing the patient recurrently, when we're talking to them about preventive health, when we can address things as they're coming more preventively than reactionary, people don't go to the dentist and say, people wouldn't say, hey, doctor, I just want to call and check in and let you know that I need a crown. The patient isn't that well in tune with oral health to understand exactly the ailment or the problem. Oh, doctor, I need to talk to you about periodontal disease. Have you heard of patients in mass coming to the dentist to talk about periodontal disease? It doesn't hurt. It's asymptomatic. It's not bleeding enough for me to really be concerned about. I mean, it bleeds a little bit, but it doesn't bleed that much. Do I really need to see a dentist? If the hygienist is talking to the patient, the customer, about here's what we need to do to address your overall health, and you need some additional therapy far beyond what we can do in hygiene, you need to see the doctor. And the doctor's going to treat you for this, that, and the other. And it's a little bit out of my scope. I mean, I'm not a clinician. I didn't grow up to be a dentist, but what I've observed over and over again is that the business system or the flow of patients, if we can keep them in one operatory and treat them for same-day dentistry, if we can focus on addressing the needs of the patient and understanding what those needs truly are, rather than making the assumption that they either have the ability or have the means, treat them like they're part of your family. Patients tend to respond relatively well. Beyond consulting, the one additional point I would throw in there is that the way that we see this, doctors have a recipe card really with 3 ingredients. There's business acumen that they need to have in order to run a successful business. The most successful businesses have been proven over and again that with a coach or a consultant produce 1.5 to 2 times more than their counterparts that don't have a coach. And then lastly is this idea of business outsourcing. Who's doing HR? Who's doing marketing? Who's doing IT support? Who's doing compliance training? Those things often get left by the wayside, and the unfortunate part for the dentist is that they're under all the same jurisdiction and compliance requirements that Henry Schein is as a Fortune 500 company, large and above. And just from an HR compliance standpoint, 97% of everything that Henry Schein has to do, small business has to do as well. Really, the differentiation is on benefit supplement support. It's a broad
line up all those
part of our business.
All the people we just mentioned was Ryan, and then we'll roll them all out in a program.
Sounds great.
But your bodyguard there,
yeah, my bodyguard
is ready to pull you. So hey, thanks for coming and talking to me.
Absolutely.
All right, buddy.
Thank you.
Bye bye.